So Dr. Scott Poland is with us. He's a professor at Nova Southeastern University, Florida, and leads the suicide and violence prevention team at the same institution. I'll turn it over to Dr. Poland. Thank you.
Thank you very much, Josh. Thank everyone for being here today, and I hope to say some things that'll be meaningful and helpful to every single one of you. I'm pretty sure I'm not the only survivor that's here today. I lost my father to suicide when I was 25. I'm a pretty good example of somebody who never thought it could happen in my family. You know, I remember everything about that last conversation that I had with him, and I should have realized what he was thinking about. And I should have asked him directly. And you know, what's really holding suicide prevention back in our country, and especially in our schools, is we are afraid to talk about it. And when you bring it up with a kid, especially, it gives them a chance to unburden themselves, to realize they are not alone. There is actually help available for them. So we got to talk about this more. And I'll quote our Surgeon General, about 47,000 suicides a year in this country. We got to talk about it more in our homes, our schools, our places of worship, and in the workplace. I have a long background with this, having first begun working in the schools over 40 years ago. I worked in the Texas schools for 25 years. And, you know, I still remember being called into that first classroom one day too late after the suicide of a student. And back in the 80s, I got the chance to actually speak before the Texas legislature about the need for suicide prevention in the schools. You know, I was really excited because the Texas legislature in 1989 passed a resolution, but then I was pretty naive. You know what a resolution or a recommendation means? It would be nice if you did this, but Texas schools didn't do it. They never got around to it. So afraid of bringing it up, and because schools are asked to do so many things. Finally, in 2013, they actually passed a mandate. And to be very direct, that's what Montana needs, is a mandate for suicide prevention in the schools. And I want to thank Carl for mentioning the Crisis Action School Toolkit on Suicide that my wife, a former principal, and I did. And that toolkit was basically mailed to every single building principal in Montana. Now, it came out in 2017. And a really great question would be, we're 5 years later. What's new? Well, I asked, and Montana doesn't have any new legislation requiring any training or additional work by schools on suicide prevention. And we're in the process of updating it, as Carl mentioned. And yes, we have some new data about the incidents, but the bottom line is the challenges are still there. And we must approach suicide prevention in the schools with the buy-in from the superintendent, the school board, the principals. I've been involved in countless state projects. And here's what I believe strongly. Suicide prevention in schools can't be site-based. It needs to come from the state. It needs to come from the school board. The superintendent needs to say, you need to do X, Y, and Z to work on suicide prevention in your school. And if you do more than that, well, that would be even better. But we need to have mandates. I cannot overemphasize that. So the Cast S was sponsored by NAMI Montana, by Big Sky Psychiatry. We got a lot of valuable input from Carl and the Office of Public Instruction. the School Administrators Association, and the Montana Department of Health and Human Services. 3 sections: suicide prevention, suicide intervention, and suicide postvention. There are 32 tools in STEPS that can be downloaded, modified, and used by the schools in Montana. You know, when I read about yet another youth suicide, I usually think of it pretty simply: untreated or undertreated mental illness, but often in combination with an adverse childhood experience. So what is that? Adverse childhood experiences, all those things we don't want to have happen to a kid: being bullied, living in poverty, living with a mentally ill or a substance abusing parent, being physically, emotionally, sexually abused, having lots of losses, deaths of caregivers, or maybe even a caregiver that's been incarcerated. So when we add some mental health issues, and then we add adverse childhood experiences, and then we add the availability of lethal means, suicides are much more likely to occur. And something that Stephanie was talking about earlier that I really want to compliment her on was we need connections. And at the simplest level, some of you have kids in schools. What's a simple question? Who is your go-to trusted adult at school? When do I get the most concerned? When a kid doesn't have a go-to trusted adult. You see, I believe that most youth suicides could have been prevented because they almost always talk to peers about their plans. And we need kids to go to trusted adults. And we need kids to know the resources in terms of how do I help myself? How do I help a friend? And I hear almost every day from somebody in a school about the problem of youth suicide. And we have increasing numbers of elementary age students that are talking about suicide. And yes, we have to take it seriously, even if the kid's 9 years old. I mean, I wish they could say, I'm frustrated about something, I'm angry about something, but if they start talking about death and suicide, we've got to take it very seriously. And Carl already talked about the Youth Risk Behavior Surveillance Survey. So we're not going to spend any more time on that. But I have a thought for you, and that is Montana has had among the highest suicide rates in America for decades. Montana has to decide to put the resources to do something about that. You can't accept that Montana is always just going to be one of the states with the highest suicide rates. And suicide is a wicked problem. And, you know, a book I read just the other day made the point, we got to make life worth living. And a lot of suicide prevention is about connections, making sure that young people are connected to families and civic leaders and school leaders. And I believe strongly that schools have a tremendous opportunity here. You know what my greatest hope would be? Utilizing all those programs that Carl talked about. Every kid graduating from a high school in Montana would know how to help themselves if they're ever suicidal, how to get help for the college roommate, how to get help for a coworker, how to get help for the elderly neighbor who lives next door. And when a suicide does occur, think of it this way. It's like taking a rock and throwing it into a pond. That ripple effect is everywhere. And it's not just a single school or a single community. Social media, that's why the impact is so great. Vulnerable young people find each other online. I often find that schools underestimate the impact of a suicide. And what little postvention research we have, it basically says our interventions are too short in duration. They focus on too few students. So if I was listening today, I'd want to know what worked to prevent youth suicide. And many of these points have already been made. And I know it's Montana, so I'm going to choose my words carefully. I'm never going to question an adult's right to own a gun. I'm simply going to say, with that right comes a responsibility to safeguard that gun from a troubled, impulsive, angry, depressed, substance abusing, maybe even mentally ill person that resides in your very own home. Securing guns when we know somebody in our family is really struggling will save lives. And we've got to interrupt all these adverse childhood experiences. And I'm really glad that Lisa talked about we do have to get physicians much more involved. And you know, Lisa, my dad went to see his doctor just a couple of weeks before he died by suicide. We've got to get physicians involved, and we've got to get school administrators involved. And schools must partner with all the local, county, and the state resources. Youth most at risk. You can all glance at this and you'll immediately see we've talked about many of them already today, but we haven't really mentioned youth in foster care, youth that are homeless, youth with disabilities, youth with substance abuse problems, youth engaging in self-injury, i.e. cutting or burning. Self-injury is a coping mechanism. It releases endorphins. It regulates emotions. But they're actually getting comfortable with harming their body. And by the way, that cutting behavior isn't working as well today as it might have worked months ago. And many young people, sadly, are exposed to suicide. And we would always think immediately, does the research say it's the closest friends? No, it doesn't. The research says it's other young people in the school or the community that weren't close to the victim, but they have their own sad set of circumstances, and they've thought about suicide before, and now it's much more on their minds. So what the World Health Organization say protects youth from suicide? Stable families. You know, I'm proud to tell you I got the Helping Parkland Heal Award after the tragic shooting. But what was my message to the parents in Parkland? When a kid lives in a stable home, when they're shown unconditional love every day, every way, that kid can overcome almost anything. But you're immediately thinking, not every kid's shown that unconditional love. Not every kid lives in a stable home. The rest of these are pretty self-explanatory, except they got a question for you. Who does a disturbed kid turn to for help? I'm going to say, unfortunately, they probably turn to another disturbed kid. And between two of them, they don't have enough sense to get an adult involved. And then I want to give a personal example. My son was 8. Jeremy, I need to talk to you a little more about the death of your grandfather. He said, I'm sorry I never met my grandpa, but you already told me he had a heart attack. That's true, son. He did have a heart attack. There's more to this story. 2 weeks after his heart attack, your grandfather shot himself. The word suicide. I wanted to give you the complete information, and I wanted you to hear this from me, never from someone else. He said, you lied to me. No, just waiting till you were 8. I thought maybe you can understand what that means. Then he looks up and says, oh, Dad, you shouldn't feel guilty. Oh, why is that? Well, your father wasn't a psychologist like mine. He didn't teach you all the things I know about how important it is to feel good about yourself. And Dad, every kid has problems. They just have to believe they'll get through it and to know to go to an adult for help. Coping and problem-solving skills. That's what we want to be teaching every kid in Montana. And Carl mentioned several great programs to do that. And it is so important that we work on connections and our schools, community, and our places of worship. and that we remove lethal means when somebody we know is suicidal. So what do I believe suicide prevention in the schools should look like? And this is 40 years of working on this. Annual training every year for everybody who interacts with students. What to look for, what to do, don't keep a secret. Work as a part of a team, and it needs to be mandated or it will not happen. We need policies and procedures to guide the school personnel. We need to make sure that they understand the importance of notifying parents. It's only one exception. You tell me you believe the kid's being abused, now we're calling protective services. And we need our school mental health professionals to be comfortable with screening with the ASQ or with the Columbia Suicide Severity Rating Scale. And the bottom line is they need to practice. They need to role play to get comfortable with asking the direct questions. And the school mental health professionals must keep the principal notified of what's going on, and they need to keep careful records. And they need to refer for a comprehensive community-based assessment. But the challenge is making sure that those mental health professionals at the hospital or in the community are actually well-trained on suicide risk assessment and management. So there's the statement about parent notification, absolutely. And getting the parents to understand we must take this seriously. We're going to work to help you obtain the needed community-based assessment and treatment for your child. And I always like to go to a school district website. Since we know suicide is the second leading cause of death for middle school and high school students, we know suicide thoughts have increased for elementary age kids. We know suicides have gone up for children of color. So I just go to the website and I put in that search engine at the school district, youth suicide, teenage depression. What comes up? Because 988, crisis helpline, crisis text line numbers should come up. Warning signs of suicide. And maybe most importantly, who do I contact at school to get started with getting help for myself or for my kid? And we've really got to provide information for parents. And just a few weeks ago, a dad said, how do I know my teenage daughter's depressed? I mean, she's a teenager, right? They're moody, they're irritable. I think she's withdrawing from our family. She's going away to college next year. Dad, let me ask you a couple of key questions. Is this persistent? Has this gone on for several weeks? Yes, it has. Is it pervasive? Is it affecting home, school, peers pretty much her entire life? Yes. Has she dropped out of something that was previously pleasurable? As a matter of fact, she has. She was on the dance team for years, but this year as a senior, I couldn't believe it when she said, I don't care about dance anymore. Dad, I'm pretty sure you've got a depressed teenage daughter. Do not hesitate to get her help. So that's to make the point, we've got to provide information for parents on the website, through meetings. I mean, I learned decades ago, you title a meeting for parents, suicide prevention is everybody's responsibility. Not very many of them are going to show up. So how do I title meetings today? Raising a child in a challenging time, building success and resiliency. And yes, they're going to get some information about suicide prevention. And we've got to make those referrals for community-based services. We've got to follow up at school. We need to make sure a written safety plan is developed. And if it didn't happen at the hospital, then the school counselor needs to sit down jointly with the student side by side and talk about internally and externally, what are your ideas to keep yourself safe? And too much important information is hidden from school mental health professionals. We need the private practitioners and the hospital personnel to say to parents, I really need to share some information with the school so they can be alert to warning signs of suicide. And schools need to look at the programs recommended by Carl and DPHHS and implement those programs. That is really essential. And we need to always know depression is treatable. Suicide is preventable. Montana needs resources. They need a mandate to make sure that schools actually are carrying out their partnership role in suicide prevention. We need to increase connections. I always like to say, every kid is somebody's son or daughter, and they need our very best. And around the country, there's been a call for a lot more school mental health professionals. So here are the facts I know. And I was the president of the National Association of School Psychologists some years ago. So how many school psychologists are there? What's the ratio of them to students nationwide? 1 to 1,500. What does NASS say is the recommended ratio? 1 to 500. So we need to triple school psychologists. What's the ratio of school counselors to students nationwide? 1 to 454. What's the American School Counselor Association say? That ratio should be 1 to 250. And here in Florida, we learned that we need to increase social workers 10 times. Schools are actually the logical place to start some mental health services for children. And the Surgeon General put out a report in November, only about 8 months ago, protecting the mental health of our youth. It cited the increased number of emergency visits for young people that were suicidal. It made recommendations for schools, for caregivers, for the community and students themselves. And it even had a statement in there about social media. Social media is wreaking havoc with our youth, making them think they're not good enough, smart enough, nor rich enough. This is a very challenging time to be a kid, and we really need to increase resources. And it's been an honor to be on this panel today, and I think it's very important that we have a chance to answer questions. But Montana needs a mandate so that every school in the state will carry out their important partnership role in preventing youth suicide.
Thank you so much, Dr. Poland.